The trends of last week continue with cases of flu and COVID on the rise in southeast Michigan. But there are lots of other illnesses circulating as well, often with similar symptoms. Our Dr. Frank McGeorge here with us with a closer look in his weekly report of what's going around. Hi, Doc.
Hey, Jason. Yeah, we saw an increase in the state numbers yesterday, and that's really being reflected on the front lines as well. Most hospitals are seeing an uptick in cases of COVID, but the encouraging news is that most people are being discharged to home and not requiring hospitalization. Now, here's what's going around near you. In Wayne County, all of the hospitals we talk to are seeing a rise in COVID cases in children and adults. Trinity St. Mary Mercy Livonia is treating more flu as well. Dr. Kevin Daisy at Children's Hospital is still reporting lots of kids with stomach viruses and more asthma flare-ups with the changing weather. The CVS mini clinics are seeing sinus infections and strep throat too. Moving to Oakland County, a slight increase in COVID being reported by most hospitals. Dr. Stephen McGraw at Ascension Providence is treating a number of patients suffering with flu or stomach viruses and more seasonal allergies as well. Henry Ford Bloomfield Hills reports a bunch of flu circulating there. The CVS Minute Clinics are also seeing sore throats and pink eye. Looking at Washtenaw County, pediatricians at Michigan Medicine report lots of kids with stomach viruses and respiratory infections, as well as some cases of COVID. Doctors on the adult side are seeing similar illnesses. Over to Macomb County, where Dr. Emily O'Reilly at McLaren Macomb says more patients are testing positive for the flu and stomach viruses remain high. She's also seeing some upper respiratory infections. The CVS Minute Clinics are seeing an increase in COVID, plus some bronchitis this week. Finally, in Livingston County, Trinity St. Joseph Mercy Livingston and the Brighton Health Center are still seeing flu and a slight rise in COVID cases. Now, given the increase in flu and COVID in the community, it's really important that you get tested if you develop any cold-like symptoms. If you are COVID positive and you're in a high-risk category, you actually need to talk to your doctor right away to see if you might benefit from Paxlovid or any of the other available treatments.
And Doc, before you go, what if someone can't get a hold of their doctor right away, or if they don't have a doctor?
Well, you can also visit one of the pharmacies that are participating in the Test to Treat program, and you can find a list of those locations near you by visiting covid.gov. The medications really work best in the first days after symptoms start, so it's important to act quickly if you test positive and are at high risk.
Absolutely. covid.gov, by the way. Good stuff. All right, Doc, we appreciate it.